It is Indiana in the Morning, always presented by First Commonwealth Bank. It's the voice of Indiana County, WCCS 101.1 FM, AM 1160, and WCCSradio.com. Well, after playing our little old game of Where's Dr. Sharda? There he is, in the studio with us this morning. Our visit presented by Marcus and Mack, voted Best Law Firm and Best Personal Injury Lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. We mentioned that November is Prostate Health Awareness Month. It's also Bladder Health Awareness Month. Doctor, good morning.
Good morning, Todd, and good morning to all our listeners today.
It's good to have you back with us here this morning. That plumbing is all connected, isn't it?
It is true. And, thank you very much for having me here today. I just requested, this program today because in the short period of, 2 years of my practice here, unfortunately, I came across many men in their 70s and 80s, who are now catheter dependent. And that's something which, for most of them could have been avoided had we, taken care in a timely manner. And that's what the bladder health is all about. And, that's what I wanted to talk to you, and for our listeners today. So, any man above the age of 50, 50% of us will have at some time in our life prostate issues. Mm-hmm. And 50% of them will need, some form of intervention. Most of the time it's just behavioral lifestyle changes, sometimes medication. Only about 10% of the people will need any type of surgical intervention. But the whole idea is that, there are certain myths associated with the urinary system. Mm-hmm. And the most common are that, most of the men think if I have a poor stream, if I'm getting up again and again in the night, if, I'm waiting for the urine stream to start, it's all part of aging up. Yes, it is. But we need to do something for that. Uh-huh. Yeah. So,
well, that you're right. That is something that we probably think, well, that's normal. That's
right.
a normal part of aging.
Right.
But there are things that we can do then.
Absolutely.
That can help us.
Absolutely. Yeah. So what happens is, what starts with this poor urinary stream and, sense of incomplete voiding, frequency urgency, if it keeps unchecked for many a times years or decades, it can lead to many issues like bladder stones, recurrent infections, blood in the urine, kidney damage. And, the worst part is sometimes you are left catheter dependent, which is like, you don't want to have a quality of life like that.
Sure.
That's the main reason which kind of, pinched me that I wanted to come and talk to the community that, I know that there are myths that whenever you walk into a urology office, you need to have a digital rectal exam and things like that. That's another myth I wanted to bust today, that digital rectal exam is, very seldomly done now. Uh-huh. So, maybe if 100 people walk in with these complaints, maybe 1 or 2 will need a digital rectal exam. Most of the time, now we have, non-invasive testing, which takes about 5-10 minutes. Mm-hmm. And we come to know, what's your bladder status, what's your prostate status. And, then we can make up a plan based on that.
So what are the things that can be done to aid in early diagnosis of problems?
So there is a simple 5-minute office-based questionnaire that we do to assess, what your complaints are. And then the test basically involve, a uroflowmetry, which only takes about 2 minutes, that you pee on a machine, and a simple ultrasound, which tells us about your bladder and your prostate and how much urine are you retaining. Mm-hmm. So these are the 2 basic things, which tell us about where you stand today.
Yeah, well, if someone says, I'm going to drink 32 ounces right before I go in there, therefore I won't have any problems.
Yeah, that's true. But again, it has to be individualized. So you don't have to drink a gallon and then, come to the office. But it's pretty much individualized, yeah.
Yeah, and one of the things about it is you're trying to determine if there is a problem, and therefore the earlier you find out there's a problem, the quicker you can treat it.
True. And, again, another myth is that if you walk into the office and you have a prostate issue, you need a surgery. No, it's not like that. As I said, only about 10% of the people are candidates for surgical interventions. Most of the time, if we do dietary modification, lifestyle modifications, and many a times medications also, which is like 1 pill or 2 pills a day, that's probably more than enough for 80 to 90% of the people.
Yeah. There are risks if you do not have diagnosed early. You mentioned having to wear a catheter,
Right.
And that's certainly one of them.
Right.
But there are even more dire consequences if you ignore problems.
Yes, true. I mean, in the extreme cases, you can have, back pressure changes on the kidney and kidney damage, which is, reversible to only, some extent, partially. So that has been the case for, many of my patients. And that's the reason, as I said.
Sure, sure. When we think about the various things that we can do lifestyle, and you mentioned dietary changes that we
Right.
can make. What are some of those?
So, it involves regulating your fluid intake and, timing of your fluid intake. So that involves that, especially as we age, the formation of your urine is switching more from the daytime to your nighttime. Somebody who's 80 is probably making 50-60% of their urine overnight rather than during the day. So, and plus it also involves, avoiding certain kind of, like alcoholic drinks and some particular time, which can have like a diuretic effect. They can throw a lot of urine in your bladder, and that can lead to retention and issues like that. So those are the things, some of the things that we mentioned. And plus, again, there is a lot of bladder training, timed warding, and other interventions that we talk about.
Yeah, I know there's the old joke about as you get older, you sleep like a baby. You're up 2 hours, you go to sleep for 2 hours. You're up 2 hours, you go to sleep for 2.
True.
If you are getting up a lot
Right.
through the night, and we're thinking about men here when we're talking about prostate, but women have problems with their bladders as well,
Right.
and with kidneys, and
Right.
and so there are things they can do as well.
Yeah, I mean, if we talk about women in that age group, the problems are slightly on a different spectrum. They struggle more with the incontinence part, and frequent infections and stuff. So that's altogether a different scenario. But again, yeah, we take care of that also, the incontinence part and frequent urine infections. A lot of our practice involves that. Yeah.
Do treatment options change a lot, or let me put it this way: have they changed significantly in the last 5 or 10 years when you deal with bladder, with prostate?
Right. So now, there are what we call as minimal invasive treatments, and there are 10 different types of treatments. So there are laser treatments, there are treatments which are different types of lasers, TURPs, there are resumes, aquablation, there is a Urolift. There are so many options, but it's not a one size fit all approach. You have to individualize based on your age, your symptoms, your prostate size, that what works best for you. And one more myth I want to, which is there in the community, is that if you have an enlarged prostate, you have more chance of having a prostate cancer. That's not the case. Again, many people fear that, but enlarged prostate does not, goes towards a prostate cancer. That's altogether a different spectrum. And we do, yearly follow-up PSA checks. And now again, we don't do much digital rectal exam. If we are suspecting a prostate cancer, it's usually an imaging with an ultrasound or MRI. So again, people have this notion that, you walk into the office with increased PSA, you will get a, transrectal ultrasound and a biopsy. That's not the case. So again, with this multiparametric MRI fusions that we have, we are avoiding biopsies for almost 50% of the people.
You mentioned that you have noticed a very large number. I don't know if it's disproportionate to other populations, but here in Indiana County, you've noticed a lot of folks that need a catheter.
Yeah. And, that's what I said. And the most common answer from my patients is that they tell me that, I thought it's all part of aging, and, everybody said that everything is good. So that's what we wanted to talk about. And then I explored more, and I found that, many people in the community, they are scared of these things, that they'll get, any invasive intervention like a cystoscopy or a digital rectal exam. That's what I wanted people to be reassured about, that not everybody needs it. Very few people will need it. But there are non-invasive things which take very less of your time, but, you can catch up the issue and you can treat if it's needed. Yeah.
So 50 years old, we should be thinking about getting to a urologist and getting checked out.
Absolutely.
How often after that? A yearly basis?
Usually, yeah, 6 months to yearly to start with. And, if everything is fine, we always go back to, once or 2 years or something like that. But again, as I said, only about 50% of the people when they turn 50 will have symptoms. So it's a very, we keep on cutting down. 50% of the people having symptoms, only 10% of those 50%, so maybe 5% will ever need a surgical intervention. So yeah, that's how it is.
If you wait until 60, do the percentages go up?
It does, and the worst part is that if you keep on delaying these interventions, the outcome is not as good as expected. That's the whole issue. So if somebody is 75 and they are catheter dependent, even if we do a prostate surgery from them, there is 65-70% chance they'll be catheter free. But 1 out of 3 people is still catheter dependent at times. So that's something which we want to avoid.
Yeah, you want to take care of all those situations as quickly as you can. Cancer, once it gets into one area of your body, doesn't stay in that one area of your body. If you don't get it taken care of,
right,
it spreads, it metastasizes, and it's not good.
And another important issue to remember is as we are growing older, more and more people are now on blood thinning medications because of their heart and there are other peripheral vascular disease issues. So again, surgical interventions again, are at a much higher risk as you grow older. Yeah.
Dr. Berjesh Sharda with us here this morning, and we talk about prostate health, bladder health for men and women. So if somebody wants to get set up with you and get this taken care of, because that's what we're talking about, is taking care of something now so that it doesn't become a big problem later. What should they do?
They should just call our office and set up an appointment. And as I said, these are just non-invasive things we can order. They can get it done and they can be taken care of.
Absolutely.
Yeah.
Hey, thanks so much for coming in.
Thank you for having me here today.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160.
Thanks.